back pain can be the upper back, middle back, and lower back. It really depends on the mode of injury. Chiropractors help in more of a holistic sense without drugs and surgery and get to the root of the problem. Some of our patients may hurt their back, from activities such as running, jumping, swimming. Other times it can be just from sitting and not doing too much. Now, chiropractors deliver something called chiropractic adjustments to the segments of the spine, which can help alleviate pressure at the joint space and the nerve, which can reduce back pain and hopefully and eventually eliminate back pain altogether. So the chiropractic adjustment is not a temporary relief mechanism, it's a long-term solution. And so the adjustments that are delivered through various treatments go right towards the specific segment that needs to be adjusted, eventually giving the patient full and complete relief. So the types of back pain conditions that we treat here at our San Francisco clinic include disc herniations, facade syndrome, lumbar sprain strains, and just your day-to-day backaches from sitting for too long or sleeping incorrectly, and much, much more. So there are two different types of back pain. There's the upper or mid back pain and the lower back pain. The treatment differs slightly chiropractically with the adjustment technique for a mid to upper back pain compared to a lower back pain. The lower back pain may include a side posture adjustment, while an upper back pain may be one where you're on your back or on your stomach. Acupuncturally, the treatment also may change just slightly depending on the area of where your pain might be. Chiropractors will use a palpation technique to feel for where the joint is more stuck, where there's inflammation built up. And this is something that chiropractors work at through training, through their schooling process. The first 2 years of chiropractic school are very similar to medical, where we do our textbook. The following 2 years, we go on more into a hands-on approach, where we're feeling, touching for stuck joints and inflammatory areas. And that's where we get our diagnostic skills in knowing where we're going to be focusing on for your treatment that day. At our San Francisco clinic, we pair the chiropractic adjustment with soft tissue modalities. That could mean active release technique or Graston technique. An active release technique is something specific where we pin the muscle and stretch it. So it's taking the patient's muscles through pin and stretches, while Graston technique is more of a specific modality using a metallic tool to break up scar tissue and adhesions. We believe that it's a combination of the adjustment with these soft tissue modalities that give the patient 100% relief. So each situation is unique and each back pain condition is different. The doctor will evaluate and do the correct orthopedic examinations to diagnose the type of back pain that you might have. The best time to go to a chiropractor is any time that you have back pain. I like to think of chiropractic as kind of the gatekeepers of healthcare. And so if a chiropractor does their examination and evaluation, full evaluation, they will determine if they can help you as a patient, or you might need emergency medicine or some sort of conventional medicine to help you get out of pain before continuing with care. So 3 reasons you may need a chiropractic adjustment for your lower back pain are: 1, your back pain points to it being a potentially pinched nerve. 2, you've tried other therapies such as massage therapy or heat therapy that just have not worked. And 3, your energy levels have dropped tremendously, even from doing the smallest tasks. That could point to a potential misalignment in your spine. In many cases, a chiropractor may offer better options for your lower back pain. From our patients' experience, when they visit a primary doctor's office, they usually get prescribed 3 things. 1, a pain reliever, anti-inflammatory, 2, and 3, a muscle relaxer. While these may offer immediate relief, they do not solve your back pain. A chiropractor will palpate and discover misalignments within the spine, soft tissue inflammation, and be able to get to the root of the problem to help facilitate your body's proper healing. Another reason chiropractic might be a better option for your lower back pain is that it is non-invasive. While conventional medicine route may prescribe pain relievers and anti-inflammatories, which have a cascade of side effects, the chiropractic adjustment has minimal to no side effects and provides actually longer lasting relief for the patient. So just like most medical therapies out there, there are sometimes some side effects that can occur from adjustments. That could include everything from a localized area of pain, sometimes an extra soreness. But we do explain that in detail, knowing that, hey, there are some side effects, especially if we're working on an area that's already inflamed. The muscle sometimes, or the joint, pushes back and gets a little bit angry. And we always recommend, palliative care at home, such as icing and stretching, that can help accompany any of the side effects that could occur from an adjustment. So depending on the type of back pain, the prognosis or relief period can change. If it's a more acute, strain of a muscle, you're going to probably notice a little bit of a faster relief and faster recovery time versus a chronic, more disc herniation that could occur from just repetitive stress at the area over a period of time. If you've waited too long to come see us, that can actually increase the length of time for you to get better. And so there is no set fixed amount of time. Our goal at our San Francisco clinic is to get you out of pain as quickly as possible. And we do that using the techniques that we have at our disposal, but also giving you some homework, which could include stretches and exercises, corrective exercises that can really help bring everything all together. No, you can definitely stop, and some of our patients do after that acute period of pain. Once we get them out of pain, great, and they may not be back until their next injury. Certain conditions, require a longer period of care, but after our care and our patients are well educated on the benefits of chiropractic, they a lot of times choose to come in for something called wellness care, which can be as frequent as once or twice a month, and coming in just to get the body checked. I like to kind of relate it to going to the mechanic to get the car checked. When you see that check engine light on, it's time to get the maintenance, and think of coming to us as that check engine light. Another great example is going to the dentist to get your teeth checked for cavities. That's important because it's a preventative measure, so that way the cavity doesn't turn into something more serious. And that's what we do as chiropractors, is we're going to go ahead and take a look at the spine. I mean, think of the spine as kind of the hard drive to a computer, and it connects to everything. And so, looking at the spine is super important. If the spine were on our face, we'd probably be paying more attention to it. But since it's in the back, we don't really get to see it too much. But this is what we're here for, is as chiropractors, we're here to actually look at the spine to see what areas are stuck, see what needs to be changed, where the pressure needs to be released. And then basically we're getting to work on that, just like other professionals might with different types of professions and conditions.